Welcome to this presentation for healthcare project management. My name is Rachel Kaiser, and a little bit about my background is in healthcare. I've been working in healthcare for over 20 years, the US healthcare system, because I have people from other countries. And I've also been working in healthcare project management for over 16 years. I wanted to share the fundamentals for anyone that would like to get within healthcare project management. How I came about with this particular presentation is I've had many questions of people asking me how to get into healthcare project management. And so that's what we're going to talk about here. We can start our presentation. The presentation is about healthcare project management. And what I want to do is for anyone who either is new to healthcare, the healthcare industry, there's so many intricacies about it. And I've learned that the best way for you to really successfully manage your project as a confident healthcare project manager is to have a good understanding of what some of the fundamentals are. Here I'm going to go high level. There's a lot certainly in each area. In fact, there's literally certifications that go within each of these areas just to be able to know what it entails. What I want to do though here is high level overviews of what these different areas that make up the patient journey and the healthcare processes so that you have a good idea, one, of what the healthcare processes are, two, that you can perhaps within this framework come to know or learn which areas would best fit you, because I have people who've asked me who are transitioning from another industry, let's say financials, or within an area on the business side, or claims processing. They could be doing claims elsewhere, but would like to do the same in healthcare. This will give you a good idea of where you think you can fit. And then once I finish this series, my next series will be about managing projects within healthcare because each is a bit different. That's the context of this presentation. As you can see here, we're going to learn healthcare processes to better manage your healthcare projects. So next up, the whole process of healthcare is called the revenue cycle. And the revenue cycle, in a short definition, encompasses the patient journey. And then what happens after the patient has seen a provider. Literally, how the patient and the providers both work with each other. One will get services and then the other has to be paid. What these processes are is what this is. You find that this process is divided up into 4 areas. The front end area, which is this area I'm going to talk about. Then the clinical operations area, which is where the patient gets services. Then the business side, it's very detailed, but it's where once a patient has gotten services, they would get claims, or if they don't have insurance, they'll be sent an invoice so that they can pay that invoice. And the 4th area is the information technology area. This is all about implementing the systems that run these areas of the patient journey or the provider's reimbursement. Okay. The first side is called the front end. It's where you have referrals, registrations, and appointment scheduling at high level. I'm going to go into each of these, explain to you what each entails. This is not a very detailed part of it because there's a lot that goes into each of these, but this is good high level information that will help you understand.